There have been instances where plaque buildup in the arteries over time resulted in a heart attack or stroke. This is known as atherosclerosis and results in them hardening. A blood clot may form in an artery due to plaque buildup, or a fragment of plaque may break off and obstruct the artery. An increased risk of atherosclerosis is also linked to irregular physical exercise. Additionally, eating a diet heavy in cholesterol, trans fats, saturated fat, and refined carbohydrates might lead to the development of arterial plaques. How can you tell your arteries are becoming clogged with plaque the best way? Although they may not always be obvious, symptoms such as weariness, coldness, shortness of breath, chest pain, and elevated blood pressure are early indicators of clogged arteries. Apart from a sedentary lifestyle and a diet heavy in trans and saturated fats, there are other risk factors that can raise the possibility of clogged arteries. Which foods are involved in the accumulation of plaque? Regardless of our age, it's critical to keep an eye on the meals we eat every day. So let's talk about the 5 meals we need to stay away from in order to keep our arterial system in good condition. I want to remind you before we start that the only objective of this video is instructional. If you feel any discomfort that could be indicative of a heart attack or stroke, such as chest pains, shortness of breath, or numbness in your left arm, you should get medical help right once. Number 1, white bread. Because it is a highly processed white bread that is absorbed and digested fast, raising blood sugar levels and causing inflammation, white bread is horrible for clogging arteries. If the process persists, this may raise triglyceride and cholesterol levels even more. According to certain research, diets heavy in refined carbohydrates, like white bread, may be a factor in the development of chronic inflammation. The correlation between persistent inflammation and an increased risk of cardiovascular disease is widely established. White bread not only has a high glycemic index, but also has the potential to raise blood sugar levels quickly after ingestion. Insulin production rises in response to elevated blood sugar levels, which may eventually lead to insulin resistance. Insulin resistance is recognized to raise the risk of cardiovascular disease. It has been shown that consuming large quantities of refined carbohydrates, like those in white bread, may also be linked to weight gain and obesity. Obesity is linked to several health disorders, including heart disease and stroke, and it increases the chance of developing these conditions. Therefore, you should eat whole wheat bread rather than white bread. The high fiber content of whole wheat has been linked to better cardiovascular health. Low-density lipoprotein, LDL cholesterol levels are lowered by whole grain fiber, which lowers the risk of heart disease. Because whole wheat contains antioxidants, it may also help to lower inflammation and oxidative stress on the cardiovascular system. Whole wheat also contains a lot of vitamins, minerals, and healthy plant chemicals that can help prevent some illnesses. Complex carbs, which can help control blood sugar levels and provide you energy, are also present in whole wheat. Number 2, red meat. Eating red meat raises the risk of cardiovascular disease, including the possibility of clogged arteries. This risk is especially high when red meat is consumed in excess, and especially when it is processed. One major source of saturated fats is the eating of red meat, especially fatty cuts. High consumption of saturated fats has been associated with elevated levels of LDL, low-density lipoprotein, cholesterol, which is commonly referred to as bad cholesterol. Atherosclerosis, or the buildup of plaque in the arteries, may be exacerbated by an increase in low-density lipoprotein cholesterol. An elevated risk of heart attack and stroke can result from atherosclerosis. As such, it's critical to restrict the consumption of saturated fats. It's advised to substitute unsaturated fats, which are present in foods like avocados, almonds, and olive oil, for saturated fats in your diet. Healthy heart health may result from these fats, as they can raise good cholesterol or high-density lipoprotein, HDL cholesterol. It's also critical to stop smoking and partake in regular physical activity. By following these guidelines, the risk of atherosclerosis and heart disease can be decreased. Number 3, fried foods. Meals that are fried, such as fried fish, donuts, chicken wings, and French fries. These meals are frequently fried in oils that are high in saturated fat, particularly when deep frying is being done. Because of their high calorie content, these meals may cause weight gain and other health issues. Furthermore, the saturated fats in them have the potential to raise cholesterol. Excessive consumption of these fats in the diet has been demonstrated to increase LDL, low-density lipoprotein, cholesterol, or bad cholesterol. Atherosclerosis, a condition linked to the buildup of plaque in the arteries, is exacerbated by elevated low-density lipoprotein, LDL cholesterol. Frequent frying, especially of foods cooked in toxic oils, can exacerbate atherosclerosis, oxidative stress, and inflammation. Eating nutrient-dense foods and using healthy cooking techniques will help you preserve vascular health. In order to enjoy fried meals in moderation, you should pair them with a diet high in fruits, vegetables, whole grains, lean proteins, and other nutrients, and well-balanced. Number 4, alcohol. Alcohol use and arteries have a complicated relationship, and the effects can differ based on a person's lifestyle, health status, and amount of alcohol ingested. Overindulgence in alcohol consumption has been linked to hypertension or elevated blood pressure, which raises the risk of atherosclerosis and other cardiovascular conditions. An extended period of alcohol misuse may lead to systemic inflammation. The hallmark of atherosclerosis is inflammation. As a result, drinking alcohol may raise your risk of atherosclerosis and cardiovascular conditions. It is crucial to restrict your alcohol intake if you want to lower your chance of contracting these illnesses. When it comes to alcohol drinking, moderation is essential. Let's move on to the final food that causes artery blockage. Number 5, high sodium. Americans love anything salty, from pizza to hot dogs to popcorn and chips. More salt is consumed in the U.S. than in any other nation in the world. 90% of adults and children in the U.S. overindulge in salt, and their demand for it is only growing. Foods high in salt include deli meat, noodles, frozen meals, canned soups, and canned goods. For optimal functioning, the body needs sodium, and salt is a great supplier of this element. However, consuming too much salt is linked to an increased risk of heart disease and stroke. Bread and rolls, which have no salt flavor at all, are among the foods that provide us with the most sodium on a daily basis, along with pizza, sandwiches, deli meats, soups, cheese, tacos and burritos, potato chips, fried chicken, scrambled eggs, and omelets. An excessive amount of salt and sodium in your bloodstream causes your blood vessels to retain more blood by drawing water into them. Blood pressure naturally rises as a result, and plaque eventually forms on the stretched blood vessel walls, preventing blood flow. To maintain healthy arteries, you should therefore think about consuming less sodium and more potassium, magnesium, dark leafy greens, and dairy products that are high in calcium. As we disclose the 5 foods that excessive consumption is advised, it's critical to concentrate on consuming wholesome meals. Sustaining a healthy lifestyle requires eating a balanced diet rich in vitamins and minerals. Consuming poor food might increase your risk of developing diabetes, obesity, heart attacks, and strokes. If you think this video is educational, please forward it to someone who might find it useful. Thank you for watching, and we hope to see you in the future video. To see more health-related content, please click the bell symbol to subscribe to our channel.